And welcome back, everybody. Hey, you know, our first guests are board members of the Bronx Community Health Network. And they join us today for a look at healthcare funding. It's important. And we welcome Marjorie Cadogan. She said, I wonder if you can say that right. And John Ruiz. We welcome you guys to the show.
Thank you.
Thank you very much.
You're in there, right?
Yeah, you got it. You got it.
All right, so we're talking about funding here. There's a lot of people that are trying to do away with funding. A lot of people trying to get more funding. What's the story?
Well, we actually feel fortunate that finally last Friday, the Congress passed a funding bill that provides funding for an organization like ours. And to tell you a little bit about the Bronx Community Health Network, we are a caring and innovative organization that provides primary health care as well as community and wellness programs for the Bronx. We serve about 133,000 visits a year, and we're part of a network of community health centers that are vital to the state. Mm-hmm. There are about 10,000 community health centers across the state, and all of them are very important and need funding. So we're happy that we got it. Yeah. It took a long time to get there in this Congress, so we want to make sure that we keep it and get more, frankly.
Yeah.
Yeah,
So,
we've been in existence since 1996, and we started off with 5 partners, and we're up to 21 community health and school-based community health centers throughout the Bronx. And one thing that I like to say about our organization is the board members. We're client-based board members, and also folks that are interested in promoting health care to the Bronx population.
well, thank God for the board members that you guys have on board.
Absolutely, and more importantly, the staff that we have there, such as the patient navigators, the community health care folks that work with the clients, the emergency liaison folks that work with the social service segment of the community to address the homeless population, employment, education, those areas which is important for the client that attends the healthcare network, because it's not just the clinical aspect. You also have to deal with the social factors in the communities, and by and large, the monies that with the federally funded grants that we get in the community have a big economic impact in the community, because we're hiring diverse workers in these clinics.
So tell us, there's a big outreach going on, as well as centers where people can just come in, right?
Right.
Tell us about both.
Well, we provide community health workers that actually go into the community and really help to reinforce the clinical messages to make sure that individuals with preventable and chronic diseases can really manage those diseases, that they can maintain their diets to help them with hypertension or blood pressure, that they can get the kind of exercise that they need, that they can take advantage of the wonderful parks in the Bronx, and to really be an encouragement so that when they are visiting their doctor, that they are getting the best holistic care that they can get.
Who falls under your plan?
Well, we don't turn no one away.
No one.
We don't
No
turn
one
no
gets
one
turned
away. We look at it, we treat the neediest of the needies, whether the ability to pay or not pay. If they don't have insurance, we have a social network there that help the folks obtain insurance. If they need food, we have pantries available in the community. If they need education, we have folks that are helping to get the education that they need.
And Bob, that's really the benefit of the federal funding that we get. It allows us to serve Bronx residents regardless of their ability to pay.
Yeah.
Our organization is Starship in the Bronx. You're second to none. We're out there in the community, we're hard workers, and we're addressing the needs of the neediest of the community.
And you didn't just start this. You said you started in 1996, was it?
Absolutely.
Absolutely.
Yeah.
And we still have some founder members on the board that, with their help, it's gotten us this far. So we have to give due respect to them and also to the leadership. Executive director is there in the forefront, and the leadership is there. along with the board members and the staff, because you got to have the troops.
Yeah.
The
yeah.
troops are the ones that are doing the work.
We're going to come out there and maybe have some cameras watch you guys in
That'd
action.
be great. We would love that.
We welcome that.
We
You have
love
anything
it.
coming up that we can be a part of?
Sure, we'll get back to you in terms of our next event, but you could come and spot check us.
Oh, no, we don't want to just check you. We just want to be a
wanna
part.
come hang out.
Yeah, we
You
want to be
could
a
come-
part of what's going on.
You could come have lunch with
No,
us, see what we do,
We
talk,
would love to have you at
talk
one
to
of
the
centers.
clients,
Yeah.
talk to
Yeah,
the
yeah.
children that we serve.
Tell us about some of the success stories. I mean, you always have
Well,
people that have worked with you and then they come back and or
I-
somebody
I-
that you've served and they come back
I
to work with
witnessed
you.
one lady that we had an annual event last year, and the lady came up from one of the centers, and she was diabetic, and now she's free from diabetes.
Whoa.
And that's huge. That was huge.
Yeah.
Yeah,
So
it's-
we like to get our clinics competitive and evidence-based outcomes. That here's a person that was diabetic and no longer is diabetic. She lost the weight, and how did she do that? With the dedicated staff that was at the center,
Yeah.
the education, the nutritionist, the doctor. So it's a holistic approach.
Yeah, and I'm sure that, the feeling must be tremendous. The people on your board, your staff,
Absolutely.
everybody working
Absolutely.
together in the same direction for a common cause.
Yeah.
And you don't want anybody on the board or anybody a part of your team who doesn't have the same feelings that you have, because there'll be something missing there. You want to
there's a-
burn on all cylinders.
There's a lot of
See,
commitment. There's
yeah.
a lot of commitment in the organization at all levels. And you asked about events, and John was telling you about our annual meeting, which is a big event that's coming up in May. And that's when we really do get to hear
It's
from
in
the
New York?
patients. It's here in the Bronx.
All right.
When we get to hear from patients, and they tell us what Bronx Community Health Network has meant to their lives and how it's really changed their lives and improved it.
Yeah, it's not like going to a regular physician where, they usually give you a prescription, I call them drive-bys. And go home and get better. When you come to our clinics, you're going to be sitting down with a physician that's going to take their time with you and explain things to you. Many people feel when they go to a doctor, oh, I don't know what they're going to tell. But my experience as a client has been, and my wife has been, that they take the time to explain things to us.
Yeah.
And build that relationship, that trusting relationship there's carrying there.
And you get
And
down
that's
to the
important.
bottom of the problem. You said you
Exactly.
deal with them on a more personal level.
Absolutely.
there's
You
so
don't
many
have that drive-by thing that you were talking about.
Yeah.
There's so many resources at each of the centers. It's not just, as John mentioned, the clinical services, but specialty services, pharmacy. It's a one-stop shop in terms of
Yeah,
health and
yeah.
wellness. So it makes it very more convenient for folks to get their care.
Yeah, that's good
At
for a
a
lot of people.
reasonable cost. May I say, at a reasonable cost, because if you look at it, at healthcare in America, Wall Street's involved in healthcare. That's what's driving the prices out of this world.
You hit it on the head. That's it. That's it.
We have to get big business out of healthcare.
Yeah.
That's what we have to
And
do.
that's a whole nother conversation, too. You guys want to come back again?
Of
Sure, we'll
course.
come back for that.
They won't let me stretch this out into something else.
And hopefully you can invite Elizabeth Rothenthorpe that wrote the book American Sickness, How
Yeah.
to Get Big Business Out of Medical Care.
You're going to come back and do it?
Well,
Sure.
if you invite us, we'll
Let's
be
talk
more,
about it. You
we'll
always
be more
invite
than
us.
glad to come back, believe me.
Okay. Where can we go and get more information on what we spoke about today?
Well, you can certainly go onto our website, which is bchnhealth.org. You can call us, or we're all social media networked at BCHN Health. So the other thing that we want to make sure that people know is that on March 5th, there's going to be a visit to Albany to thank our legislators,
Oh, okay.
but also to tell
Is
them.
that Sumos? That's part of Sumos?
No, it's after Somos.
After Sumos.
It's after Somos. But it is equally important to be out there and tell our legislators how important facilities and organizations like BCHN are. So we hope
I'll
folks
see
to
you up there
join
this
us.
weekend also.
Okay.
Caucus weekend. I give them a big round of applause, everybody. Marjorie Cadogan,
Thank
Bronx
you.
Community Health Network Board of Directors, and John Ruiz, Bronx Community Health Network Board of Directors. Thank you guys so much.
so
And you
much.
got to come back. We'll open it up
Thank you,
and
Bob.
maybe open it up a can of worms, but it's okay. We can do
okay.
that.
I like that.
Time for dialogue.
There you
Yeah,
go.
yeah.
Thank you guys so much. We have to take a quick break right here, but stay tuned. We'll be right back with more Open next.